Good evening and thanks for joining us on this COVID-19 update program at this hour here on Channels Television. I am Ladi Akiri-Duluale. Here are the highlights at this hour. President Buhari adds 1 million households to the social register for palliatives as he extends 3-location lockdown by 2 weeks. Government ramps up efficient testing mechanisms for COVID-19. And more than 1.8 million COVID-19 cases have now been confirmed around the world. President Muhammadu Buhari has extended the current restriction of movement in Lagos, Ogun states, and the Federal Capital Territory for another 14 days, effective from 11:59 p.m. tonight. The president said this had become necessary after considering the briefings and reports from the Presidential Task Force, as well as the various options offered. To ease the burden of the lockdown, the president has directed that 1 million households should be added to the social register to increase the total number to 3.6 million. He assured governors that the federal government, through the Presidential Task Force, will do whatever it takes to support every state during this period. On the measures to protect the economy, the president has asked that the ministers of Industry, Trade and Investment, Communication and Digital Economy, as well as Science and Technology, Transportation, Aviation, Interior, Health, Works and Housing, Labor and Employment, and Education should jointly develop a comprehensive policy for the Nigerian economy functioning with COVID-19. To ensure food security after the new coronavirus, President Buhari also directed the Minister of Agriculture and Rural Development, the National Security Advisor, the Vice Chairman of the National Food Security Council, as well as the Chairman of the Presidential Fertilizer Initiative, to work with the Presidential Task Force on COVID-19 to ensure the impact of the pandemic on the country's 2020 farming season is minimized. President Buhari also used the opportunity of the broadcast to point out to some of the gains made in the first 2 weeks of the lockdown.
As a result of the overwhelming support and cooperation received, we were able to achieve a lot during these 14 days of initial lockdown. We implemented comprehensive public health measures that intensified our case identification, testing, isolation, and contact tracing capabilities. To date, we have identified 92% of all identified contacts, while doubling the number of testing laboratories in the country and raising our testing capacity to 1,500 tests per day. We also train over 7,000 healthcare workers on infection prevention and control while deploying NCDC teams to 19 states of the Federation. Lagos and Abuja today have the capacity to admit some 1,000 patients each across several treatment centers. Many state governments have also made provisions for isolation wards and treatment centers. We will also build similar centers near our airports and land borders.
The President Muhammadu Buhari earlier on today. So far, countries across the African continent and further afield have implemented varying testing strategies in their countries with a no one-size-fits-all approach used universally. Since the first case of the new COVID-19 was reported in Nigeria on the 28th of February, the federal government has come under fire on the rate of testing being carried out. But today, the coordinator of the Presidential Task Force on COVID-19, Dr. Sani Aliu, explained that the testing kits are expensive and have to be deployed for optimal use.
Is it time to relax testing? Absolutely not. Remember, these test kits, A, they're expensive, B, every country in the world wants it. There's no room for massive community testing of coronavirus. I would rather do 100 tests and get 10 positive than do 1,000 tests and get 10 positive. It's all about improving the efficiency of the test. It's much better to test persons that have symptoms, because what we call the pre-test probability is much higher. When we talk about incubation periods, this is the period between when you get an infection and the time the symptoms happen. And the incubation period is the period when the virus multiplies deep in the body and it is not excreted. The way we do the test for coronavirus is a PCR test where you do a swab from the nose and the throat. If you are in the incubation period, you will not be excreting the virus. And the test is looking for the presence of the virus. Therefore, if you do the test during the incubation period, which may range from between 2-3 days to up to 14 days, the test will be negative. You might have a mild sore throat when you wake up in the morning, you not even notice that you've forgotten it, or have a mild cough for a few hours in a day and it will not even bother you. Maybe already you have a cough like a smoker, etc. So in those instances, you would think that you are asymptomatic, but in actual fact, you do have mild symptoms. Respiratory viruses over time have evolved to induce coughing, sneezing, and runny nose so that they can get out of the body. That's how they infect the next person. And that's why those symptoms are there. And that's why we need to do the test at the right time in order to pick up the virus. So the answer really is absolutely not. We're not going to start doing massive testing in the community. It will be inefficient, it will be expensive, and it's not going to help us increase the number of positives.
Coordinator of the Presidential Task Force on COVID-19, Dr. Sunny Liu. Now, let's stay in Abuja, and we're joined by our correspondent, Linda Akibe, who is in our Abuja studios. Linda, first of all, let me begin by asking you, what did some of the residents you were able to speak to in the time between the broadcast of the president and now, what did they make of the extension of this restriction of movement?
Yeah, hello, Ladi. So I spoke with several individuals, including medical doctors and concerned Nigerians, to get their reactions on the president's broadcast, particularly the extension of the lockdown. Now, the reactions have been mixed. Now, some medical doctors told me that they are not in support of the extension of the lockdown because it appears that the number of infections is declining. And according to them, the extension is like a panic response. Now, they're also worried that the economic issues which will arise from this lockdown may wipe out the gains. They're also skeptical about the president's announcement of expanding the social register by registering 1 million people, like he said, and they question how this can be achieved in 2 weeks. So more or less, they're saying these people might be registered after the 2 weeks has passed, so defeating, I wouldn't say defeating the purpose of including this 1 million people in the space of this 2 weeks. Now, another viewpoint from some people I spoke with is that they support the extension of the lockdown in the 3 states, and they're even calling for an extension beyond the 3 states. I know some of the people I spoke with said they want a total lockdown of the country, like what is happening in India, to prevent a further spread of the virus. But their concern is the palliatives to cushion the effects of the lockdown. They are dissatisfied with the compilation of names in the National Social Register, questioning the process of getting these people. Like the same concerns have been raised repeatedly in the last 2 days. The last few days, we saw the Senate President and even the Speaker also questioning the procedure for getting these people in the National Social Register. And they're suggesting that the federal and state governments should extend these palliative to more Nigerians, maybe using the BVN and even the voters' cards to reach more people. There's also the worry about, armed robbery attacks occurring during the lockdown, like the reports we're getting from Lagos and Ogun states recently, and that if the extension of the lockdown will exacerbate this problem. Ladi.
Now, Linda, just before I lose you very briefly, what was the compliance level like today in Abuja?
Okay, so, The compliance, what we've been seeing is average compliance in Abuja. That's what we've seen in the last 2 weeks. The FCT, the compliance level in the FCT has been mixed. Now, in the city center, there's been a good level of compliance. Non-essential businesses are shut, and there are few cars on the road. But we're still seeing large numbers of joggers in the streets in the morning, and they're not maintaining physical distancing from each other. And this is worrying, as it almost defeats the purpose of this lockdown. And it's a completely different scenario in the satellite towns in the FCT. Like, in the satellite towns, that's where you have the majority of residents, or large numbers of residents. This is where they reside, and you still see people moving about in their numbers, and non-essential businesses are open. I'm talking of drinking bars. I noticed a drinking bar in Lube is still operating. And we're still seeing traffic jams in the Karo Nyanya access into the city center. And these traffic jams are caused by, security agents checking cars coming into the city. And then you have to wonder if all these people are working in essential services and where they're going to. Ladi.
Thank you very much, Linda. Keep reporting there from our Abuja studios. Linda, thank you very, very much. Now, on a happier note, while we focus on confirmed cases and fatalities, both in Nigeria and elsewhere, there have been, in fact, quite a number of survivors. And one of those survivors, in fact, one of the most prominent of those survivors in Nigeria, is the governor of Bauchi State, Alhaji Bala Mohammed, who used to be the minister of the Federal Capital Territory. Thanks for staying with us. Welcome back. Now, Governor Bala Mohammed is not the only COVID-19 survivor talking about his experience. One of the other survivors is a Lagos resident, Kazeem Adedeji, who tested negative to COVID-19 after undergoing treatment. And he speaks exclusively to Channels TV on how he contracted the virus, life at the isolation center, and the battle against stigmatization.
I was one of the luckiest patients in there, because my case wasn't as crazy as some other people who passed away, or people who were like some horrible things you see a grown-up man doing that you go feel sorry for them, seriously. Can you imagine someone want to go to the toilet, and before getting into the toilet, had to put himself. A grown-up man. All I'm just going to pass on to people out there is stay indoor. Staying indoor temporarily is better than staying down feet below forever. So stay indoor. This thing is real, and it's not joking. It's real. It's real. As I talk to you now, my wife is still in there, and my mother-in-law is still in there. So if I'm to write a book, I think I'm going to have, I don't know how many pages I will be writing, but I don't know. I really don't know where to start from. But to be honest, it's not something I want anyone to experience. You can imagine in my situation, I had nobody to look after my 2 kids except my maid that was lucky to be negative. At the same time, my 2 kids that were lucky to be negative. So, and you can imagine what it is for me, the father, not be in with the kids, the mother not be in, the grandmother that can easily be entrusted as well, not being in. So we were left with no choice other than the maid that we've only hired about 2 months ago. But luckily for us, she was negative. At the same time, she was being helpful. No one is going to accept my kids. No one is going to look after them. They're going to be scared. Like, the parents has got coronavirus, they probably have as well. So that alone weighs me down. My wife cries every day, and my mother-in-law was disturbed. I have to just stand like a man. I was really worried within myself, but I just have to pretend like everything is okay. But it wasn't some kind of experience I would want someone to go through, to be honest. On my way coming in, I met someone that used to do something for me on my way. So I told him, look here, I've always been telling you this thing is real. Can you believe I've just been discharged this and that? And she had to run away. Then I had to call him back and be like, what's going on with you? You don't have to run for me. I'm good now. And, but I think, I might have a bit of, things to deal with, but I'll be all right. I can deal with it. I'll be all right.
COVID-19 survivor Kazim Adedeji, who resides in Lagos. Well, he's not the only one. One other person is the Chief Medical Director of the University College Hospital, that's the UCH in Ibadan, the Oyo State capital, Professor Jesse Otegbayo. Although he is also in the medical line, his experience is a tale he would love to share with everyone.
2 weeks before the test was carried out on me, I'm positive. I'd been on high dose of vitamin C because I knew that my job places me at a higher risk than an average person, and I was trying to take preventive measures. So 2 weeks even before that time, I'd been on vitamin C. And of course, my physicians who were taking care of me also asked me to take chloroquine. I did. I took some things that contain vitamin C essentially because of the antioxidant property, which sort of reduce inflammatory processes in the body. So essentially, those were the things I did. And of course, I took a lot of fluid just to make sure that I'm not dehydrated and wash off whatever can be washed off through the urine. So, and I rested, I did some exercises, and now the rest is history. There are several studies that have shown that vitamin C definitely helps reduce inflammatory processes. But it does not have antiviral property because it does not kill the virus or even reduce its capability to infect. What it does is that it reduces inflammation that the virus will cause, therefore reducing the possibility of disease and therefore symptoms. There's a difference between having the virus and manifesting the effects of the disease that the virus can cause. Yes, I had the infection, but I did not have the disease.
The Chief Medical Director of the University College Hospital, Ibadan, Professor Jesse Otegbayo, speaking about his experience in surviving COVID-19. Now, I'm being joined in the studio by a public health physician, Dr. Japhet Olubogi. Thank you so much for coming in at this time.
Thank you for having me, Ladi.
Now, let's take a look. Were you surprised that the president extended the lockdown in these 3 areas?
No, I wasn't.
Why not?
Because a lot of work is still going on, and we have not quite caught up with the virus yet. So a lot of work is going on, and the extension of the lockdown was actually being expected. Although maybe not 14 days, maybe just 7 days. Maybe a bit of relaxation for people to be able to cope with eating and feeding and making some living. But we were expecting some form of lockdown extension.
Now, what the president talks about having gotten 92% of the contacts that they were trying to trace of those who have been confirmed and so on, and that leaves that's 8%, and that a number of other things have also been achieved in the first 2 weeks,
Yes.
but that these 2 weeks are still necessary. Let me use your phrase, to catch up with the virus. What areas should we be focusing on now in this phase of the lockdown? Let me put it that way.
Thank you very much, Ladi. I'm not quite certain about the 92% being quoted by the president, but I'll just leave that by the side. Right now, in the next 2 weeks, we need to do, we are already doing aggressive, active case search. What that means is that we are going from home to homes, from household to household, from one facility to the other, that's a health facility to the other, searching for symptoms that are in tandem with COVID-19. When we do this, we're able to pick up people in the community whom we have missed by way of they not reporting or we not tracing them or the contact not being defined. So through that avenue, we can pick them up from the community and test them. So we are doing this for the next 2 weeks. In fact, we're supposed to do it for 10 days, but for certain reasons, for logistics reasons and all that, we may have to do in some areas extend it beyond that 10 days. So apart from that, we also intensifying our testing capabilities. There was a slide being shown, being shared, where we have the comparison of the testing and the number of cases in Africa. And we can all see that Nigeria is lagging behind on that chart.
Then the president talks about ramping up our capacity for testing now to 1,500 tests per day.
Yes. In fact, in Lagos, the target is more than 1,500. The target is about 2,000. If we can do that for the next 10, 14 days, at least we'll be able to mop up the virus, the people who have the virus from the community. If you compare what we've been doing, we had not been testing enough, and that's due to a lot of reasons, logistics, reagents, test kits, and all that, lab availability of lab centers themselves. So right now in Lagos, we are extending test centers to the LGAs. There's plan in place to put in place test centers in at least 20 LGAs in the state, where people can walk in, where health workers can investigate cases, detect and test as many as possible, so that we can have a balance. And when we compare the number of cases we have and the number of testings we are doing, we can hit our hands on our chest and say, okay, we are doing something worth the salt.
Now, you're one of those on the front line, so maybe one can ask, the PPE issue, and then the other welfare issue that has to do with hazard allowances and life insurance. And how important do you think that is to medical personnel in being able to do their work? Start, for example, with the PPEs. Is the situation with that improved now?
Well, absolutely. The PPEs, the availability of PPEs for medical personnel, it's very important. You cannot underrate, you cannot underestimate, and we cannot say too much about the availability of PPE, not just for the public health practitioners, also for the private practitioners as well. It's like going to a war and a soldier does not have a gun or does not have a, what they call it now?
Body armor?
A body armor. As such, a soldier would not be confident enough to put him or herself in the front line. So that is how it is for a medical practitioner. When you have the availability of PPEs, the essential PPEs that you need, gloves, face masks, the body suits and all that, you, inside of yourself, you feel that sense of protection that you can go out all out to give all of yourself to the fight against COVID-19. But when you don't have that, the motivation is not there. And then don't forget also, they have families at home, back at home. They have friends, they have colleagues, they have loved ones. So if they're not well protected, they can also pick up the virus and then go back, spread the virus. In places like China and Italy, most of the individuals that spread the virus are actually medical personnel, health workers.
But a bit of that is already happening here. You have doctors on lockdown at the University of Benin Teaching Hospital.
Absolutely.
You have nurses on strike in Enugu and a number of other places, all complaining that,
Yes, and that underscores the importance of the availability of PPEs for medical personnel.
Now, of course, I mentioned the other things as aspects of welfare, which enables...
welfare and insurance as well. The incentivizing medical workers during this lockdown, it's just the right thing to do. I mean, everybody else is staying at home. Some people are going to the forefront, put their all into it, leaving their families back home, putting their all into it. It's just normal. It's just all right for us to at least appreciate them by incentivizing them. This motivates them as much as possible. And then when they have that health insurance, at least we know we're not praying for anybody to die, but at least they have it at the back of mind that whatever happens to them, they have loved ones, they have next of kin who can at least have some form of benefit. Unlike when they don't feel the impact of government, they don't feel the impact of governance, and they don't have it at the back of their mind that they are being protected, they can't give their all.
Now, that brings now to where we are as it is now. There have been a couple of loopholes. The lockdown hasn't been completely a lockdown, and so much has been said about that already.
Yes.
Even the president had to make mention of it because he talked about the fact that this is no joke. We need to take this very seriously.
Yes, no joke at all.
Other people are, paying the price for not taking it seriously at the
Absolutely.
beginning. Now, that then brings us to why people seem not to be completely on board with this. There are two aspects to it. The first is some have pointed out to awareness. Is that really a point?
Yeah, well, we have done a lot of awareness, but we know in Nigeria, a lot of people are still skeptical due to the fact that the Nigerian thing, if I may put that in quotes, a lot of people don't trust government, number one. A lot of people don't think that the government is actually being truthful with them. But there's been a lot of awareness. Anybody who says he or she has not heard of COVID-19 now is probably not living in Nigeria. Because it's everywhere. The news is out there. The media, everybody has been saying a lot of things about it. So people know, but they're just being skeptical about the truthfulness of government in all this. Then the second aspect of it, which you didn't want to mention, I know you...
No, I was just waiting. I'm going to mention it, which is the question of the economic imperatives.
The fact that a lot of people in Lagos especially, are traders, are businessmen. There are people who depend on daily wages. We have a lot of artisans and all that, and laborers. So they need to make some form of living. They need to make some form of money to be able to feed themselves and their family. So when they cannot earn that money, when they cannot earn that living, it becomes a big of a problem. So it's one of the issues that is affecting the lockdown, not being effective, not being maximum. Let me put it that way.
Now, if that is the situation as it is now, going forward, if we were to take it forward now, if you were to identify 3 or 4 key things,
yes,
what would those be that we need to do quickly within this 10 days or 2 weeks that we are now being given as an extension?
Obviously, for us as medical experts, what we need to do is detect, during active case search, detect, detect, test, and isolate. That is, we detect all those cases that are remaining in the
system,
in the community, test them. Any one of them that comes out positive, we isolate them, take them away from the pool. Like I always say, using an algorithm of a fish pond, if you have a dead fish in the pond, you have to take that fish away from the pond. Take care of that fish or whatever. Remove the water so that you can save the remaining fish in that pond. So we have to detect, test, and isolate whoever comes out positive. Then on the issue of social infrastructure, the government, I don't know. I don't think the government alone can do it, because you cannot be bringing 1,000 bags of rice for people of population of about 360,000 or 500 in a particular area.
Location,
so yes, we all need to come together, the private sector, the organized private sector, even the unorganized private sector, whatever that is, to assist the government to identify the poor, the poorest of the poor, the needy, to assist them, to give them palliatives as much as possible. If not, there's no way we can achieve a total lockdown. And if you don't achieve a total lockdown, if you don't achieve social distancing, we cannot curb completely the scourge of this virus. And like the president said, it is better for us to ensure that we do that so that we don't face the worst case scenario, which we are familiar with.
All right. Spain is one of the countries that has quite faced a worst case scenario. But now they've decided to relax their lockdown measures imposed to curb the spread of COVID-19 by allowing people in the construction business to get back to work to help boost the economy. Now, this comes as more than 1.8 million people around the world have now contracted COVID-19, and more than 117,000 of them have died. The country's health ministry, that's the Spanish health ministry, says daily numbers of deaths have dipped slightly, with 517 reported in the previous 24 hours, compared with 619 announced on Sunday. Other parts of the world continue to grapple with the pandemic as well. Thanks for staying tuned. Welcome back to our COVID-19 special at this hour. And now, as promised, from outside our shores, we go to Dallas, Texas, in the United States, where we have Professor of Surgery and Associate Dean of Global Health at the UT Southwestern Medical Center, Dallas, Dr. Fiemo Wariako. I hope I got that right. Good evening, Doc. Welcome to our COVID-19 special program.
Thanks for having me, Laddie.
Now, what's the situation in the United States? I know it's tough. We've seen mass graves in New York, and we've heard stories about death toll surpassing even that of Italy and Spain. But what is the situation there today?
Well, first of all, thank you for having me. The U.S., is, like most countries, has had a really tough time with this pandemic. As you know, the first case was earlier in the year, and many of the health systems, including the U.S. system, struggled to keep up with the rapid pace of infection and obviously in deaths. But one thing that's different in the U.S. is that it's so much more heterogeneous than many other countries. So what happens in New York or Florida is different from what happens in Texas or California. So it's very mixed. I will say the biggest, New York has taken the brunt of this burden, and a lot of people have gone to help out there.
Now, it does not seem as if the U.S. is considering a lockdown like the Chinese have considered and like some other countries, including Nigeria, have implemented so far. Is there a special strategy to that, do you think, or is it that that doesn't quite work in every situation?
Well, as you may have heard from the experts, social distancing and self-isolation are quite effective. So whichever country can do that or community can do that, it actually makes a difference in the spread and the prevalence. Challenges in the countries is that the U.S. is a federation of states. So although there's a federal government, it really can't impose its will on state governors or mayors of cities or local administrative units. So you'll find that the lockdown that you see, it varies amongst U.S. cities. I would say it's much more common in large urban cities. Dallas, where I live, which is home to several million people, has a very strong mayor, and they've done a fantastic job of keeping most of us at home.
Now, Nigeria has just extended its lockdown. This evening, the president extended it by 2 more weeks. What do you think that period should be used for in order to flatten, as they say, I mean, it's your language, flatten the curve of these infections?
So different places are doing different things. If you listen to the CDC here and many of the other agencies around the world, testing is a critical piece of this. So the more people we test, the more people we know and confirm have infections, and the more we can isolate them, the sooner we can, as you say, flatten the curve or reduce the speed at which this disease spreads. And remember, we're not trying to prevent people from getting it. We're just trying to have people not get the disease so quickly that it overwhelms the health system in the communities where they live. So this time, I think we've spent trying to ramp up our testing, get more rapid testing in place. And in places like Nigeria, a lot of the contact tracing can be done while the lockdown is in place. And this will help us keep some of the people who are exposed or infected separate from the uninfected people in the population.
Now, of course, our president did say that during the first 2 weeks of this lockdown, as it were, in these areas, 92% of the people that were being looked for have, in fact, been identified. So probably the last 2 weeks will be used to look for the 8%. And going by what you've just said, that will be, of course, useful in flattening the curve. I want to thank our Associate Dean of Global Health at the UT Southwestern Medical Center in Dallas, Dr. Fiemo Wariako, for being with us. Thank you so much from Dallas in Texas.
Thank you for having me, Laddie. Pleasure.
And that's how we're going to wrap it up on today's edition of COVID-19, the 9 p.m. segment. Thank you for being with us. Of course, do keep the tweets and comments coming. We're receiving them. And, of course, we also would like to have your videos, come in about what you're doing during this lockdown. Send us a picture or short video or how you're observing this sit at home. Just been extended for another 2 weeks. The handles are right there on your screen. Thank you so much for being with us. My name is Ladi Akridoluale. Good evening.